At 10, the Panhandle seeing an increase in patients with respiratory illnesses. News Channel 10's Sydney Batzloff joining us now. Sydney, how is this year different than previous years?
Well, Greg, in the fall and winter months, respiratory illnesses are common. But this year, health experts say we're seeing it earlier and numbers are exceedingly high. Because of this increase, the city of Amarillo, along with leaders from area hospitals, held a conference today to discuss what they're seeing. Health experts call it a triple-demic. Patients are coming in with flu, RSV, or COVID, and in rare cases, they have 2 out of 3. The problem is overflow in area emergency rooms with double-digit holds.
So we want to encourage people to be able to utilize the most appropriate care for their particular medical condition. That not only helps save them money and oftentimes time to be able to contact their primary care physician if that's appropriate, staying at home if that's appropriate, and going to the emergency room if that's appropriate.
This not only helps the healthcare system, but it helps with access to the ER. Some of the red flags you might experience when you're feeling sick and deciding on whether to go to the emergency room include symptoms like difficulty breathing, chest pains, dehydration, or feeling weak. Hospitals say with the overflow, there have been times they've had to divert ambulances.
There are times when we've had to go on diversion simply because we're not able to confidently feel like we're going to be able to manage that patient potentially coming in from an outside rural community as fast as they may need to be managed.
As for hospital beds, BSA, Northwest, and the VA say they are not at max capacity, but beds are filling up. The city also mentions right now with respiratory cases, the numbers are the same as the peak last year, and it's only the beginning of the season. Sydney Batzloff, News Channel 10.